I'm so excited to introduce Dr. Anne Peled. She is my medical advisor, and she is duly trained as a breast surgeon and a plastic surgeon, which is just incredible to me. And she has done amazing things with her husband that is helping the breast cancer community in such a way that is so cutting edge. And I'm really excited today to bring some of these techniques and her unique experience to the forefront. I'd love to find out more about you, Dr. Anne Peled, on who you are and why you do what you do, and all about the unique things you're doing in the breast cancer space.
Thanks so much, Cynthia. As you mentioned, I'm dual trained as a breast cancer surgeon and a plastic surgeon. I did both residency and fellowship training and all of that. And so I'm in private practice in San Francisco, and also working at a big hospital system as part of their breast cancer program, primarily doing combination breast cancer surgery and breast reconstruction. So both taking care of people with breast cancer, also doing prophylactic surgeries. And honestly, for me, I've been in practice now for, I guess, 8+ years, and really love taking care of patients with breast cancer and being part of that journey. But a lot of the work that I've done has really come from my own diagnosis of breast cancer 5 years ago. And for me, honestly, that really transformed how I think about care, how I think about what it's like to go through the process. And one of the things that's come out of that is this development of this technique that I do with my husband, Zeev, who is a peripheral nerve surgeon, called sensation preserving mastectomy. And really the idea with that is to try to allow people to keep sensation after they've had a mastectomy, where typically all the nerves are cut and people end up being completely numb afterwards. So that's something we're really excited to have pioneered, excited to be teaching people, and incredibly excited to see that that's really taking off at this point.
Where can a breast cancer patient get this type of cutting edge surgery? I mean, I never knew about it. So how do we find out about it, and who does it?
So, it really is relatively new. I would say even in the last year or two, we're finally seeing a lot of teams being willing to adopt it and take this on, because you really need both the breast cancer surgeon and the plastic surgeon to be trained to understand how to preserve nerves during the mastectomy that can be saved from an oncologic standpoint, and then also to reconstruct those that can't. So there are many surgeons now that are learning. There are many surgeons that have adopted this into their practices across the country. And so I always say to people, ask, is this an option? Is it possible to have sensation preservation? Can you have nerve reconstruction during your mastectomy? And the hope is that if you have a surgeon who doesn't do it, by your asking, that may actually lead them to think about learning how to do this training and allow it to be a part of their practice for other people. And then also, if they don't do it, perhaps they're going to refer you to someone else. So I certainly see a lot of patients who wonderfully their breast surgeon has actually sent them to me because it's not something they have in their toolbox. So it's definitely now more and more common. There are lots of places across the country. The key is really to know that sensation loss happens after mastectomy, which unfortunately a lot of people don't even know. And then second, to know that you can ask for it.
What percentage of breast surgeons in the US right now are aware of this or doing this, would you say?
So it was really exciting. I just gave a talk at our annual Society of Breast Surgeons meeting, and on this topic, and they actually polled the audience, and 20% of people said that they have started doing this and thinking about it. So honestly, that's incredibly exciting, because I would have said it was about 3 practices not that long ago. So it's definitely something that now there are a lot of breast surgeons out there interested in and taking on in their practices.
And is the awareness of sensation preserving mastectomies out there in a way that you would want it to be? Do you feel that women really truly understand this unique technique?
Unfortunately not. I just met someone recently who literally lives, a few minutes from my office and just had a non-sensation preserving mastectomy in my city 6 months ago, and didn't know that it existed. So I think, sites like yours, sites like other places, other groups that are really trying to spread the word about this is so important, because a lot of things that happen in breast cancer surgery and other techniques and technologies really comes from patients asking for it, and that driving force of patients knowing they could have more, they could have different, they could have better, and that transforms care for everyone.
And who's a candidate?
I mean, honestly, we pretty much offer it to anyone in our practice having a mastectomy. There are some small caveats. Certainly, if you have a tumor sitting right in the area where the nerves are running, that wouldn't be a good reason or good opportunity to offer this. But in most other cases, people are having mastectomies. Certainly, we can try not to injure nerves. Because truly, it's not just the numbness that comes with nerve injury, but it's also chronic pain due to scarring that happens at the nerve ends. So that's one thing. So really the idea of trying to preserve nerves that can be safely preserved should be an option for everyone. And then nerve reconstruction really can happen with many different kinds of reconstruction. It can happen with flat closure. So those are definitely great options to have if you have a plastic surgeon who's trained in those techniques.
Can a person like myself who's been 4 years out somehow find a way to get nerves back, or is it one shot only time to get
No,
that?
I mean, fortunately, it's not. So it turns out with nerves that provide sensation, theoretically, those nerves can be reconstructed at any time. So right now, we don't always know heading into surgery whether or not people still have some nerve left behind from their mastectomy. If they've had radiation, sometimes the nerves can be kind of scarred. But we always say to people that if you're up for trying and you understand that we don't necessarily know how it's going to go until we get in there, that we can totally look for nerves and try to reconstruct them, even if you had a mastectomy a long time ago.
Where do you get the nerves?
So you use actually cadaver nerve grafts that have had all of the cells taken out of them. And so it's basically a scaffold for your own nerve to grow. So during your surgery, if we're going back, we look for nerves along the side of the chest that have been cut and injured during the mastectomy. We try to find a nice clean end of those nerves, and then we use a cadaver nerve graft to reconstruct it to a nerve in the center of your chest.
Hey, this is incredibly cutting edge, and this is so cool. So I think also that the fact that all these new things that are happening, and that's why I'm so excited to have medical advisors like you be part of this global movement, because women do need to be empowered about what you're doing. And so, can you talk about, in addition to you, but all the new things that are happening, behind the scenes? We, as and I being a survivor myself, had no clue about so much. And so together, by bringing this to the forefront, can you talk about what else is going on in your world to help women understand, and possibly men?
For sure. I mean, I think a lot of the things wonderfully have to do with making sure that we're accounting for quality of life. Fortunately, we do an incredibly good job treating breast cancer. Early stage breast cancer is highly curable. Even people who have metastatic disease, wonderfully, in many cases, can live a really long time with our current medications and regimens. So, really, what we're trying to think is if we're going to have people living decades and decades after breast cancer, how can we try to make that life as good as possible? And so, some of the things that fall into that category, one of my favorite things to talk about is oncoplastic surgery. People understand that with a mastectomy, you may have reconstruction, you can be offered reconstruction and choose to have it or not. But a lot of people don't realize that if you have a lumpectomy, you should also get reconstruction. And whether that's just something small like hiding your scar and making sure that your tissue is reshaped so you don't have a big dent or divot, which is really a visible reminder every single day that you had cancer, to honestly people who maybe have always wanted a breast reduction their whole life. They've had large breasts. Now they have cancer, and there's a bit of a silver lining that now in that same surgery, you can have your cancer taken out with nice wide margins and also have a breast reduction all done at the same time. So I think that's one thing that unfortunately a lot of people still don't know about, even though there are so many of us that are trained in oncoplastic surgery. There's so many courses that are in oncoplastic surgery. So I think that's a big one. I think another one that I'm really excited about is trying to avoid and treat lymphedema. Lymphedema can be a huge issue for people, very debilitating, long-term chronic problem. And so some of the things we can do, one is we can try to avoid doing lymph node surgery altogether. So we have good data that in certain people who have kind of small cancer that's very favorable, they don't even need lymph node surgery anymore. Next, we have the option for people who have DCIS, stage 0 cancer, who used to have lymph node surgery done at the time of their mastectomy, because the idea was if we found invasive cancer, we couldn't really go back after the fact. But now we have this amazing technology called delayed sentinel lymph node biopsy, where we can actually put a tracer in the breast at the time of mastectomy for people with DCIS. The tracer goes to the lymph nodes. It stays there for 30 days. So now we can do the mastectomy, not do the lymph node biopsy. And then if the pathology comes back and shows invasive cancer, now we have 30 days to go back and do a lymph node biopsy. And honestly, that saved 85% of people with DCIS having mastectomy, lymph node surgery that they never needed in the first place. So I think that's incredibly exciting to see that. And then the final thing for lymphedema is we're now, for people who need more extensive lymph node surgery, offering a procedure called Lympha. And Lympha, what it does is it actually does a little lymphatic venous bypass all in the same surgery as your lymph node dissection. So the idea is you're actually going to reroute those channels during that surgery to prevent the usual scarring in, the fibrosis that can happen in the lymphatic system and lead to swelling. So these are kind of remarkable options that we have that basically allow us to prevent lymphedema, to reduce the chance that it happens, and then even honestly, in some cases, then to use these techniques to treat lymphedema as well. So I have to say, those things kind of blow me away, that those are options we didn't have even a few years ago.
And we need to get this out there, because I have many friends in the community that are suffering from lymphedema, and the prevention strategies that you surgeons know about is not in our hands. We don't understand, and we don't even think about that. So thank you for that. We need to talk about that more.
For sure. Now, lymphedema is a big one. It's a really, like you said, it's hard. Once it's progressed, it's very hard to treat. So the real key for lymphedema is preventing it in the first place, or early detection and trying to treat it when it's in an early stage.
I never heard of any of this, so this is really incredible. Getting all the information. So, because you're obviously, as a survivor yourself and you're in this space, you knew about all of this. What's your thoughts and tips for anyone newly diagnosed to get this? I mean, this is really cutting edge information. And if we miss this window, we don't know. So what would your recommendation be as far as getting the information and understanding all of this?
So I think the first thing is that it can be really daunting to just kind of go on Google and search these things, right? And so it's one of the reasons I love sending people to Learn, Look, Locate, some of the other communities that I'm a part of, because what you get there is a few things. One is you get true experts in the field who understand what they're doing, who are kind of at that cutting edge point, people who are pushing the field forward. And so they can talk about what those options are, because like and we've talked about, you don't know what you don't know. And so at least hearing what is out there so you can take it back to your local team is really important. It also allows you to engage and interact with other community members who've been through it recently. So, we always say wonderfully, like, it's not your grandmother's breast cancer right now. It may not even be your mother's breast cancer either, And so I think this idea that you're actually interacting with people who maybe just had their treatment 6 months ago, or, someone that you can connect with in real time, see what's going on, and not just someone that, maybe someone's aunt who got treated 40 years ago, which can also be really scary, right? Because a lot of the ways we used to treat breast cancer do leave a lot of really very scary chronic problems. So I think that's in my mind is one of the first things. I think it's also incredibly important to seek second or even third opinions. And I always say, as a physician for myself, I never, ever am upset about someone asking for a second opinion. In fact, I really encourage it, because my idea is what's, best case scenario, someone sees someone else, they get more information, they hear things again, because it's so hard to take it all in at the beginning. They get different pieces, and then they feel good about the plan. It's maybe the same plan I've offered. It's something they're comfortable with, and they come back. Other scenario, which is also great too, is I'm not the right fit for them. They go somewhere else that feels like a better fit, and then everyone wins because they get to be in the place with a team that they're comfortable with. So I always say to people, if you ask for a second opinion and you get pushback, that says something about your provider, that they're not open to really focusing on you and what you need, because you're the only person that wakes up in your body every day. And then I think the third thing is time. So it's really scary psychologically, getting a breast cancer diagnosis. Again, I've been there. It is terrifying, and you feel like you want it out tomorrow. But most breast cancers have time. And whether it's weeks or in some cases even months, you have time to get all the information you need, to get those second opinions, to get additional testing you might need, just to make sure that when you head into surgery or other treatments, you're as best informed as you can be, because the people who know the most going in do the best on the other side. So I think those are, in my mind, really the keys to make sure that you are getting access to everything and information to what you need.
So like being an empowered patient is the best patient,
For
because
sure,
this
no
is
question.
all new terminology and everything about this is so very new. I want to ask you about the emotional side of breast cancer, you being someone who's been stricken with this, and then what you think how the world is dealing with, as both of us being so heavily on social media. I think it's important to talk about the emotional impact that's going on with the individual, and also that it's affecting more and more younger women. So, your thoughts on that?
For sure. I mean, I think there's so much to say about social media. My general feeling is that it's a really positive thing. Again, it gives you access, it gives you information, it gives you community. But I think it is so incredibly important to remember that we're all individuals in this process and all of our journeys are different. And so, on the one hand, I think ideally you're finding a community of people that are in a similar position to yours. So, I know certainly going through breast cancer when you're young, it is really different. You know, if you're thinking about fertility issues, maybe, you're thinking about having decades and decades to come and what the impact is going to be, you're having just really different conversations about what that means. It is really lovely to be in a community with other young people going through this. However, your issues may not be their issues, and the things they may be worried about might not be yours. And there might be some things in there that you don't want to engage in. And you don't have to be a person that totally shares your entire life story out in social media. And you don't have to be kind of the, magical survivor showing that you're out, running every single day and doing all this, when really all you want to do is kind of curl up after you've gotten through chemo. And I think that kind of grace that we have to give all of ourselves and understand that this is inherently a really traumatic and really disruptive process that in some cases lasts for a long time. That's the other thing. I was just at an event and it was beautiful and incredible, and other survivors and thrivers and previvors. But I'm 5+ years out and I still got a little triggered by certain things there. And I think for me, I, rather than kind of, oh, why am I being triggered? And I should be not doing this anymore. And I'm 5 years out and all these things, I try to give myself that grace and space to say, this was triggering. This is where I am right now. I need some space. I can't engage in this community in this moment. I need a break for myself, and then kind of come back when I'm ready. And I think it can be hard to give yourself that break from all of this, but we all have to do it to take care of ourselves.
Bring up a good point, because I'm in this space that I've never been in. I've been doing this a couple years, and the survivor's guilt is hard, because I have some very dear friends, I'm sure you can relate, that are not with us anymore. So survivor's guilt as a survivor is very real, and also stepping away, especially as entrenched as you are in doing this every day, and then you being someone that's been hit with this, so is very real. I want to ask you also about the future of breast cancer. When I interviewed you last, you said, I hope someday we never have to do mastectomies. It is really, really quite barbaric, that we need to remove body parts. Your thoughts on, kind of where the future of all this is going? I mean, there's a lot with artificial intelligence that I read about, with mammography. I mean, and there's even with other companies doing artificial intelligence to help you guys find the tumor more accurately than I know about. What are your thoughts on, is there hope that we will not have to chop our breasts off anymore?
I really, really do think there is. I mean, I think one of the first, so it's both the idea in my mind, it's going to be prevention, and then it's also going to be early detection. And so I think from the prevention side, there are some really great and exciting trials going on right now looking at vaccines to prevent more aggressive types of breast cancer, like triple negative and HER2 positive. And that is amazing, to think that we may have some data from that in the not too distant future. I mean, that would be incredible. And then in terms of early detection, that idea that, hopefully we won't need at least mastectomies, because we'll be able to tailor our breast cancer treatment, and make it much smaller because we're diagnosing breast cancer much earlier. And I think the idea of liquid biopsies, following people on a regular basis to see, one, are they having cancer come back if they've already had cancer? But two, is this someone that now has some circulating tumor cells that may tell us, okay, we haven't seen a cancer show up on imaging yet, but maybe it's there. And then combining with the better and better imaging techniques we get and AI, like you mentioned, I mean, I think we're going to get to a stage where we are finding breast cancers really early, where we are preventing them. And again, hopefully really just continue to scale back on more aggressive treatments that we need to treat breast cancer.
And would you say that, and so from my personal experience, the shock of how much I didn't know in the world of prevention, I feel there's a huge disconnect in the world. It's not just America, it's the US. I'm sorry, the global aspect of what's going on, because there's, women in Italy and in South Africa that I'm interviewing in their 30s. I mean, there is something very wrong. I wonder if you agree with me on the educational side of the early education to make people understand there are ways to get ahead of this through genetic testing. And there are ways by doing self-breast exams, which I never did, but making young women realize that this disease is on the rise and that it is happening. So I feel for you guys, because as surgeons, breast surgeons, you're seeing this, and I think because of what that there are ways that we can grab this. That's why I'm so committed to bringing this all together, because I think there's more we can do, right? Do you agree?
No, I totally agree. I mean, I think genetic testing is such a good example, right? I mean, it's tricky because it turns out, finding you have a genetic mutation is actually incredibly scary and disruptive as well. And for some people, I think is as traumatic as finding out you have breast cancer. And so I think that idea, I see why, some people worry about doing it. They're scared of testing. They have a strong family history of cancer and they're really nervous. But the reality is that if you have a genetic mutation or not, whether it doesn't actually unfortunately change that you have it. What it does change is that ability to actually be proactive and to get the screening you need, or to think about doing prophylactic surgery. And so I do think genetic testing and knowing your family history is incredibly important. And being willing to be brave and take that step is huge. So I think that is a big one. And then the other thing that you mentioned, especially in a lot of cultures around the world, there's a real stigma still around breast cancer. There are, sadly, people that have breast lumps for, months and years and just don't see anyone about it because of the stigma or because of fear. And so I think getting out there, I always talk about the fact that I found my breast cancer myself, because at 37, I had no family history. I wasn't getting screened. So, I think that idea, okay, you find a breast lump, it doesn't go away after a couple of weeks. You have to go in and get it checked out. And so continuing for all of us to talk about that, we're doing breast self exams, that you can be incredibly healthy. I always say I was a vegetarian triathlete. I was taking really good care of myself. Like, it still happens. And it doesn't mean that I don't still do all those things. Actually, I think it's more important than ever that I'm exercising and taking care of my health. But you still have to, move forward with your health. When you find new things, you can't ignore them. The fear can't take over, because again, it's going to be there whether, you do anything about it or not, but doing about it allows it. So I was really lucky. Fortunately, I didn't need chemotherapy in my situation because I'd gone in when it was early and it was something that just required hormone blocking therapy. So again, these are the differences. It's our taking control of our health maybe allows us to make our paths, be less disruptive and traumatic.
And one last thing, Dr. Peled, if somebody is listening to you right now and they're newly diagnosed and they're scared, they're overwhelmed, they can't even think about reconstruction right now because they just heard the words, you have breast cancer, what would you say to that person?
I mean, I think the first thing is just to kind of know that even though it feels like you're alone right now, you're really not. So we're all here. We've been through this. It's actually an incredible community of people. So many people have been touched by breast cancer that it really is pretty remarkable. So the first part is that you will find people who've been through a similar journey who can help support you so you don't feel alone. I think the next thing is trying to find someone in your life, more ideally, more than one someone who can be there with you, go to appointments, take in the information. It is incredibly overwhelming. It's very hard to keep all of it in. Once you hear the word cancer, everything else kind of goes black. And so having someone, if possible, who can be there with you to kind of take notes, keep check-in, go over your treatment plan with you is really, really priceless in so many ways. And then I think, that final piece of it is that time piece, that even though it doesn't feel like things like reconstruction or scars or outcomes, all that matters in this moment for many people is just being cancer free. But we're so lucky right now. We're at a time where you can be cancer free, but also minimize the side effects of what happens and also get to feel like yourself again. And that is possible. So you don't have to pick, it's not vain to be thinking about wanting to look like you did before surgery. None of us picked getting cancer. So I think that giving yourself, again, that kind of space and time to let that settle in, do some research is really incredibly important. And again, it's scary for all of us. But once you know what that's like to get that call, we're all kind of part of this community now where we can support each other, which is really lucky.
And you do get through it. I mean, you
Yeah.
do get to the other side. And that's why when anyone reaches out to me who's newly diagnosed, I have my hand out, we DM, we talk, we chat, we're scared. And you can be proof. We are, as we move away from it, we become the inspiration for the newly diagnosed. I should share with you in the world of Learn, Look, Locate, when I started this, the incredibly, one of them 23 in electric architectural, she was an engineer with BRCA stage 3. She's engaged, she's getting married, her hair has grown back, she's gorgeous, she's smiling. And I do tell the newly diagnosed, please go follow so and so, and you can see that they do get through this tunnel of darkness and they come out to the other side. And for many of us, we have different paths. Like I never in my wildest dreams thought I'd be here doing this,
Yeah.
but it brought me here. So it's really lovely to see, even for me, you 5 years out, and the realness that it can trigger. It's still a part of our, our minds and our bodies that this happened to us. So just the realness about that. Any last thoughts before I?
No, that's good, Cynthia. I really appreciate the work that you're doing. I think, again, for anyone watching this, the Learn, Look, Locate community really is incredible. It's a bunch of my friends who are medical advisors as well, who I know are amazing people, so knowledgeable about the breast cancer world. And so it is such a good resource for people newly diagnosed or farther along in the process, just to know what's out there. So thank you, Cynthia, for prioritizing all of that.